Question number 1. A medical student while examining a histopathological slide watches a lymphoid tissue with stratified squamous epithelium. Which of the following organs he is watching? A. Stomach. B. Spleen. C. Lymph node. D. Palatine tonsil. E. Duodenum. Correct answer is D. Palatine tonsils. From the pharyngeal side, palatine tonsils are covered with a stratified squamous epithelium, whereas a fibrous capsule links them to the wall of the pharynx. Palatine tonsils forms part of the Waldeier's ring, which comprises the adenoid, the paired tubal tonsils, the paired palatine tonsils and the lingual tonsils. Question number 2. Following are tributaries of internal jugular vein except A. Common facial vein, B. Inferior petrosal sinus, C. Inferior thyroid vein, D. Superior thyroid vein, E. Veins from pharyngeal plexus. Correct answer is C. Inferior thyroid vein. The tributaries of the internal jugular include the inferior petrosal sinus, facial, lingual, pharyngeal, superior and middle thyroid, and, occasionally, the occipital vein. The blood collected from these vessels then drains to the brachiocephalic vein and into the right atrium. The inferior thyroid vein is a blood vessel that arises from the unpaired thyroid plexus. It descends and joins the brachiocephalic vein. Question number 3. Regarding middle meningeal artery, following statements are true except A. Can be fairly located outside the skull with reference to Tyrian. B. Enters the middle cranial fossa through foramen lacrum. C. Is commonly involved in extradural hemorrhage. D. Produces grooves on the interior of the cranium. E. Supplies most of supratentorial dura mater. Correct answer is B. Enters the middle cranial fossa through foramen lacrum. The middle meningeal artery is typically the third branch of the first portion of the maxillary artery, one of the two terminal branches of the external carotid artery. Question number 4. The parotid duct opens into the vestibule of mouth at the level of crown of A. Second lower molar tooth, B. Second lower premolar tooth, C. Second upper incisor tooth, D. Second upper molar tooth, E. Second upper premolar tooth. Correct answer is D. Second upper molar tooth. The parotid duct, a long excretory duct, emerges from the front of each gland, superficial to the masseter muscle. The duct pierces the buccinator muscle, then opens into the mouth on the inner surface of the cheek, usually opposite the maxillary second molar. Question number 5. A 22-year-old man represented with swelling of parotid region. He had contracted mumps 5 weeks back, but the swelling did not resolve. He was suffering from agonizing pain in the region of parotid and ear, which increased during chewing. The nerve most likely to be mediating the pain is A. Anterior superior alveolar nerve, B. Auriculotemporal nerve, C. Glossopharyngeal nerve, D. Infraorbital nerve, E. Middle superior alveolar nerve. Correct answer is B. Auriculotemporal nerve. The pain produced can be referred to the external ear. This is because the auriculotemporal nerve provides sensory innervation to the parotid gland and the external ear. The parotid gland is a bilateral salivary gland located in the face. Question number 6. A 65-year-old woman presented with a nodule in the tongue for the last 6 months. On examination, it was found to be 1 centimeter in size, situated in the anterior 2/3 of the left side of the tongue. It was provisionally diagnosed as a malignancy. The group of lymph nodes most likely to be involved first is A. Left inferior deep cervical lymph nodes. B. Left superior deep cervical lymph nodes. C. Right inferior deep cervical lymph nodes. D. Right superior deep cervical lymph nodes. E. Submental lymph nodes. Correct answer is B. Left superior deep cervical lymph nodes. The lymphatic drainage of the tongue is complex. Lymph from the medial anterior 2/3 of the tongue travels to the deep cervical lymph nodes, and lymph from the lateral anterior tongue goes to the submandibular nodes. The tongue base lymphatics drain bilaterally into the deep cervical lymph nodes.